Welcome to the office. Welcome to the office.
Thank you.
You're coming from where, madam?
I came from Saudi Arabia.
You're from Saudi Arabia?
Yeah.
You live in Saudi Arabia?
No, I currently live in LA, but I lived in Chicago for a long time, and then I moved.
But you're here now?
But now I'm here now, yeah.
Why are you here, madam? क्या दर्द है? क्या मसला है? Problem क्या है? ¿Qué es su problema?
Problem is that when I first came to Chicago, to United States, I found out that I have osteogenesis imperfecta.
Okay, which is what? Osteogenesis imperfecta means what?
It's a brittle bone disorder.
So it's low bone density, right?
Yes.
Okay.
And it caused me losing my ears, and I had cochlear implants.
So you lost your hearing?
Yes.
And you had cochlear implants put in?
Mm-hmm.
Okay.
And I broke foot when I was younger. And
both feet? Both feet?
Yes. Different aspect.
Okay.
And but the last time I broke my foot was last year. I think that was the worst.
What did they do? They put some pins in there for you?
No, I broke this one. They just give me a cast. And
no pins?
Yeah. I had a bunion surgery when I was 22, and then a bunion surgery again.
But you have hardware in there? You have any pins or any hardware?
Yeah, I still have pain in it, and I regret that I did the surgery, to be honest. And my right foot, I broke it when I was like 10, my big toe, and my uncle friend, he put it back. He like I'm a doctor, and he was like, I'm fix it for you.
So why are you here though?
So, cause
what are you here for?
You
got stuff, but what are you here for? How can I help you?
I had a bend in my back.
Okay.
And on my upper back, it's coming. Like I practice yoga, but whenever I just stop practicing, it's come back again.
So hold on. So as long as you're doing yoga, your back feels good.
Yes.
When you're not doing any yoga, what happens?
I start to bend again. I don't feel comfortable like standing or sitting.
Okay.
Unless I have something in my back, and also my jaw. The doctor told me that I have a disc, and I need a surgery, but I didn't do it. So I'm glad I didn't.
But why are you here? For your back?
For my jaw and my back, and I guess all my body need to be.
So we need to get back in balance the best we can.
Okay.
Fair? And this is not our first visit though.
Yeah.
But you decided to share the story. So you have a few things going on. And this osteogenesis imperfecta is, they call it brittle bone. It's a chemistry issue, right? It's a chemistry issue. You were told it was genetic?
Yes.
Yeah. So, but there was something in the environment that triggered it. I want to talk about your foot first, okay? And because the foot is very important, guys. And you had bunion surgery, a couple of them, on this side, right?
Not this one.
Yeah, you had a couple. You had a couple, and you broke that one. And I want to talk about bunions and foot problems first, because it's very, very important. This is a foot model. This is the right foot model. Okay. Now, when we're looking at the foot, we have 26 bones in the foot. 6 major misalignments that occur with an inversion sprain when we roll the ankle. And I'm going to explain those 6 misalignments and why it's important. The talus is, we call this the keystone bone to the foot, because it connects the leg to the foot. Yeah? Or it's part of the ankle joint, or the mortise joint is what they call it, the mortise joint. Now, 85, as it was taught to me, 85% of all foot conditions come from a misaligned talus. And I'm going to go through the mechanics. So the first thing misaligns with an inversion sprain is an AS talus, goes anterior superior, usually tilts on the medial side, can also tilt on the lateral, but usually medial. The next thing, so that's number 1. Number 2 is going to be the posterior fibula, where it goes back. It can also rotate out this way, okay? When we see an AS talus with a posterior fibula and the fibula is rotated out, we know there's also ligament damage. Third one is going to be the calcaneus. The calcaneus will go posterior and lateral, I'm referencing here. So we have talus, fibula, calcaneus. Next thing that can happen is what? This goes out, the cuboid rolls up, and the navicular rolls down. Follow my process. Cuboid will go superior, which will then affect the 4th and 5th metatarsal. Navicular bone, which is the arch, the medial arch, will drop down. That sets up hypermobility of the midfoot and the forefoot. The hypermobility can then cause a spreading and a drop of the second cuneiform, which leads to plantar fasciitis. Okay? So, talus 1, fibula 2, calcaneus 3, cuboid 4, navicular 5, second cuneiform 6. That's the order. Next, when we're looking at bunion, and we've had a lot of bunion cases in the past, the reality of bunions is this: they are fixable. But most people won't give us the time to fix it. It's a process. It took a while to get there. It takes a while. It can take up to a year of adjustments. Okay? I'm being very straightforward. Yes. And most people don't have that time. So it doesn't mean I adjust that person every single day for a year. No. But it takes up to that. Right. Whether it's bunions or hammer toes or things like that, guys. And it's important. So the easier solution for people is the surgery. Yeah. Because that doesn't fix the problem though. Right, no. It does what? It deals with the symptom. And the way this happens is this. So you'll have a navicular, a metatarsal base off, right? So what happens with the bunion is this, again, starting at the talus, follow kinetic chain. Now, with that, you can have a couple of things. You can have a drop navicular, you can have a superior first cuneiform, you can have a superior metatarsal base, and then you have gapping. So it does this. This goes out, and to compensate, the toe comes back in. Yes. So the fix of the bunion actually happens here, not here. It starts here. When it's time to get to the bunion, there's a few steps. There's pumping the capsule this way. There's setting it, and then there's something that is missed with most people, and these are called sesamoid bones. So I got a question for the audience today, okay? For the audience. I want you guys to look up what are called sesamoid bones, and they look like little sesame seeds. And I want you to tell me, or see if you guys can guess how many sesamoid bones in the foot, and how many sesamoid bones relate to the bunion, and what the most important misaligned sesamoid bone in the foot is. Leave a comment, guys. Okay. All right. So that's a whole nother process. Okay? That all starts with talus. Now, as I said, 85% of all these foot issues come from a compensated foot due to a misaligned talus. That's why I work on the talus. Okay? Okay. All right. All right. How did you do with a couple of adjustments here?
I feel so much better. I noticed that my walk and I stand up front of the mirror. I feel like my legs is like straight, you know. That before it was like this, going like my leg was like like that.
Meaning your toes were out.
Yeah.
Your posture seems better now.
Yeah,
okay.
So much better. Yeah. I have some pains, but I know that will go away.
Process.
Yes.
Okay. Shall we get started?
Yes.
You ready? All right. This is a picture in time. 24 bones in the spine, 23 discs in between. I want to go straight to her foundation and explain what we've been working on with her. And we have the left pelvis and the sacrum. But as we look at this, there's not a lot of rotation of the sacrum. There's an ASEX on the left side, which relates to that left whole side, which goes back to the injury and why she had to get this bunion surgery. So we've been focusing on the sacrum, pelvis. We will need to get to this L5 as you can see here, right? But we can't do L5 until we have a level foundation or a stable foundation. So that's really the focus of what we're working on. And if we're looking at, she said she was diagnosed with this osteogenica imperfecta. I'm not working on any areas if the bones are too soft, right? Yeah. But wherever we're working on, you've been okay with.
Yes.
There's been no issue. So let's get to it then. We're going to continue on the foundation. Once the foundation is set, then I can work on her L5, okay? And you can see on this, there is curvature going on in the spine. As we know, my job is not to try to straighten out a spine here. What's my job? To help get back in balance of the foundation. Number one, and number two is see if we can get those side curves a little bit better. Yeah, because from here you can see it goes left, it goes right, goes straight, goes right again, goes left. All of this is compensating from her low back. Now the thing that's more concerning to me in terms of being mindful is this area. Because here I see this looks a little bit weaker, these bones. Okay, so we want to stay away from that area. All right, shall we get started? Yeah. Yalla, you ready?
Yeah.
Yalla, let's do this. Wow, it already looks straighter than before. You know that?
What?
It looks straighter than the x-ray.
Is it?
It looks like it. Bend forward and touch your toes. Down, all the way down, all the way down, all the way down. Mira. This is the area, okay, that has that, all that scar tissue in there.
Yeah, that's hard.
Yeah.
Ouch.
This is different than what that x-ray shows. Sit up for me, please. Sit up. Good. Let's run the meter on your back and let's see what we find, okay? I got you. Starting at the base of the neck. C7, C7, 10 points. Now, anytime I'm seeing any low bone density, I don't care what the condition is, okay? Anytime I see low bone density or hear low bone density, the first thing I'm thinking of is digestion. We're not absorbing and assimilating. Neurological control could be here, it could be upper cervical, and we need more acidification of the body. That way she's absorbing her nutrients better. Okay? Second thing I would do is add magnesium, not calcium. Another misconception about low bone density, thinking it's a calcium deficiency. It's more of a magnesium deficiency. Calcium is ubiquitous in everything we eat. You need to have the appropriate stomach acid in order to get it out of the foods that you eat, guys. That's basic physiology. Okay, so we're getting the sacrum, and I'm getting C7, okay? These are your two spots today.
Okay.
Okay, madam? I do want you guys to see something. From just me rubbing a little bit in that area, look what happened. It's red. So just from me touching here, you got a red, nice red spot there now.
Yeah.
Yeah, we're not touching that area. Not right now. We need to look over your blood work and go over your nutrition. Okay, madam?
Okay.
7. L5. S1.
Ouch.
S2. S3.
Oh.
Yalla.
Yeah,
S3. S3. Okay. So she came out. She got a bunch of stuff going on, dude. And I'm surprised now she wants to share her story, so that's cool. And it's a big deal for her to share her story, right? It's a big deal.
Yeah.
It's a big deal for everyone to share their story, and I want to just say
I want to write a book.
Okay.
Of my stories. I have so many.
You have a lot of stories? Yeah, me too, dude. 7 and S3. So she's still got that little Saudi left wiggle jiggle, but it's a lot better than what it was day one.
Yes.
Have a seat, please. And let's talk about our game plan, okay, for today. We're going to work on sacrum, C7. After that, I'm going to work on your ankles today. With the ankles, we'll do the jaw and we'll do the nose. Okay? Yellow. Ready? C7. C7, left, chin down, down, look down. Don't help too much, okay? Just a little bit. And it's very light, and you're flipping that switch on. Flip on that light switch. Look up and flip it. Perfect. Hi. Walk it off, please. Ah. Very nice. Very good, madam. Face down over here, please. S3. Nice and easy. Hi. أعوذ بالله من الشيطان الرجيم.
Ouch!
خلاص. Gotcha. Gotcha. But we need a little bit more still. Now you see the cobra. Hold my hand, please. Let's walk. Hi. Let's go right side down, please. So you're telling me they have cobras in Saudi, right?
Yeah.
All right, there we go. Relax there for me. Is it cobra? Relax the bottom.
Oh!
Gotcha.
Does feel good, actually.
Walk it off, please.
Oh. Give me a second.
Sure. You know what? Why don't you go on your back then? Just go on your back. Just lay down on your back. Take your time. Oh, madam. Out of both feet, which one is worse for you?
I don't know.
Right side, left? Well, the left has the bunion surgery already.
Yeah.
So we're going to focus on the right then. Okay? We're going to do the... Actually, we'll do both. Let's prep. So we're doing talus, and I'm first starting with lotion. We want to work periarticular swelling, and we're feeling if there's any. We can't really feel the scar tissue as much here.
Oh.
Hi. You get mad at me, it's okay. Yalla. You tell me if it's too much, I will stop, okay? Look at me. Hi. She don't want to look at me, okay?
I don't want to breathe.
Okay, breathe, breathe.
I don't want to
Breathe,
prepare.
breathe, 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 breathe. 5, 4, 3, 2, 1. Come on. 5, 4, 3. Jokes aside, okay? Let's get to work now. You got to put a little. She got her poker face on now. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1.
Oh.
Now, if you're filming, who's gonna hold it? All right, guys, let's do AS talus, bilateral medial tilt. You far? Come over. Come here.
Oh. Oh.
Wow. Us. Now I'll use the board to tune everything up, okay? You okay? Yeah. You can deal with it. AS talus, medial tilt, posterior fibula. Go to your left side. Posterior lateral, calcaneus. Other side, please. Chiropractic perfecta. Okay, now the fun part. Now the fun part. What's that?
More napkin.
You want one more napkin?
Yeah.
Why? Here. There you go. On your tummy. There we go. Alright. Kalas.
Kalas?
Sit up for me, please. Starting at the base. Neck is clear. What's the most important part of the office visit? What's the most important part, guys, in Gonstead? What's the most important part? There's so many components going on here, so many things happening. What's the most important thing? I would love to hear your comments, guys. Clear. Madam?
Yes. Oh.
Still adjusted her with cochlear implants, you. Easy, easy, slowly, relax, relax. That's right. I'm not going hard. Relax. Yes. Questions for me, madam? We're good?
I'm good. That's my favorite part.
The buffins and polish. How do you say in Arabic the buffin polish? How do you explain it in Arabic?
أحلى حاجة في الزيارة.
If you don't mind, what I would like you to do is just briefly in Arabic what you came for and how you feel right now. Salam, madam.
السلام عليكم.
Why did you come, madam?
جيت عشان أعمل adjustment لظهري. صراحة مرة مبسوطة. بعدني مرة كتير. لما نتعب أحس نفسي مرة كويسة. بالنسبة لفكي هذا أكثر شيء يعني مرة مبسوطة إني أبتسم.
Oh, I forgot. Sorry.
We forgot.
I forgot the jaw and the nose. Come back here. Sorry, madam. We can continue though. Open. Right, left compensation. We'll do that first. Open all the way. Open. Slowly close. Slow. Open. Close halfway. Hold. Bus. Let's go on your back.
مرة مبسوطة من ضحكتي دحين. بضحك كويس. I'm just saying that I can laugh more comfortably.
Okay.
And
Less pain.
When I yawn, I open my mouth. I used to have pain, and now I feel much better.
Chin down, please.
What?
Chin down. Look down. Septum.
Oh, ouch.
Deep breathing. Deep breathing. Deep breathing. And no, there was no sound effects with that case. Very nice, madam. Very good. Khalas, come on up. 1, 2, 3. Turn. You can continue your story.
Now I can breathe.
You can continue the story then.
Yeah, what I was saying, إنه أنا أقدر أتنفس كويس، أقدر أضحك كويس أحسن من أول، وأقدر الله يكرمكم أروح الحمام كويس، وأمشي مشيتي مرة صارت أحسن بكثير مع دلوية رجولي، مع دلوية ما صرت أمشي كويس، ظهري يوجعني، كان ما أعرف كل شيء يوجعني الظاهر، فحس إني اتولدت من جديد.
Stand up for me.
I reborn again.
It's Grace.
Thank you.
Stand over here. It's Grace. It's Grace. Elbow. Bas.
Ow.
Squeeze. Hi. All set. All done, madam.
Thank you.
Okay, you enjoy your weekend. I'll see you next week.
Yeah.
Welcome to the office.
Thank you.
You're welcome. Salam.